Now to our top story. There are many reasons to be proud of coming from the northwest: the people, the landscape, the history. But in terms of health, it's better to be a southerner than a northerner. If you live here in the northwest, the chances that you will die younger than someone from the south of England have become worse over the last 40 years. Ranveer is here with the details.
Yes, the research from Manchester University makes pretty grim reading. When it comes to how long we will live, the north-south divide is wider now than it was in the 1960s. Statistics collected between 1965 and 2008 show that northerners are 20% more likely to die under the age of 75 than those in the south. Every year, 37,000 people would have lived longer if they'd had the same life chances as those in the south. And the research reveals that there are more GPs per head of the population in the south than in the north, when it's the north that needs them the most. Andy Gill takes up the story.
Today's report makes grim reading. It suggests when it comes to life expectancy, the north-south divide is wider now than it was in the 1960s. That's despite the efforts of successive governments to close the gap. We asked people in Chorley why they think we're unhealthy.
I think a lot of it's the unemployment and the fact that we've no jobs and there's so much stress involved.
Depends on your lifestyle as well, doesn't it? I mean, I think with a poorer lifestyle or not.
If you've not got anything to do, you're just going to be sat at home, maybe not doing anything. So obviously you're not going to get motivated as much.
Manchester University analysed data from 1965 to 2008. The number of excess deaths in the north over that time was 1.5 million, as if the north were losing the population of a major city every decade. It's not just because we smoke more or eat badly. Only a fifth of the extra deaths can be explained by culture and behaviour. Today's report says differences in lifestyle and wealth are not the whole story. Southerners enjoy better health right across the social classes. Rich Southerners are healthier than rich Northerners. Poor Southerners are healthier than poor Northerners. The British Medical Journal says the economic downturn and government cuts will hit the north harder than the south. The Department of Health says it's committed to reducing health inequalities. Andy Gill, BBC North West Tonight.
Well, earlier, Gordon asked one of the report's authors, Professor Ian Buchan from Manchester University, why things are getting worse rather than better.
Well, there's a popular myth that we're not trying hard enough in the north to protect our own health. If we look at the evidence, large factors that influence health, for example, smoking, the differences between north and south in smoking would only account for 14% of this big divide we've seen in death rates, and alcohol 3.5%. The lion's share of those causes are down to social and economic factors, such as the amount of income someone has, their educational level, the amount of community resources, working environment, living environment, control over your own life.
So it's nothing to do with the way we eat, drink and smoke. It is all to do with investment, if you like, in the north. We don't have enough of it.
The investment enables people to make healthier choices, and there are other factors on top of the choices that build health. So, for example, investing in training people will attract businesses. The businesses attract wealth. The wealth creates health and stronger communities. These things are very complex and intertwined. But the public health initiatives need to go hand in hand with the business initiatives, for example, in the recovery from the recession.
So in many ways, we should be blaming governments, all governments from 1965 onwards, for not investing as much in the north as they have in the south, which is why we are dying younger here than they are in the south.
Yes, if you look at the trend in dying before your time, so the risk of dying under age 75 is 20% higher in the north than the south. And that figure has been increasing steadily since 1965, in spite of large-scale, well-intentioned initiatives by government to reduce inequalities in health. But those initiatives have been focused on the NHS. And the NHS, doesn't have the reach to go and help stimulate new business development, which will have the biggest impact. In fact, only 4% of the NHS budget is spent on prevention.
And if it's down to economic factors, it would suggest that things are going to get worse before they'll get better, because we're getting higher unemployment all the time, which you say is one of the causes.
There's a very big risk at the present time from unemployment. The north has a higher proportion of its workforce in public sector employment. Therefore, there will be a greater amount of unemployment in the north. The unemployment across all social groups leads to a greater mortality. So the risk of death is higher if you're unemployed in all social groups. That needs to be a target for investment. Maybe there is a case for northern weighting of investment in the regeneration initiatives post-recession.
How do you totally turn this around?
Social and economic investment with proper regional targeting to increase the amount of social and economic development in the north is required to deal with the causes. The NHS distribution of resources needs to be matched according to need, which means, for example, that statistic of having more GPs per head of population in the south needs to be turned around so there are more GPs per head of population in the north to deal with the consequences of this north-south divide.
Professor Buchan, thanks very much.
Thank you.
Last Saturday, Michael Stevenson set out